Hello students, welcome to Angel Health Academy. Topic for the day or topic for the session is steps in analytical study. Analytical study is the second major type of epidemiological study or observational epidemiological study. So it is a second study or second major type of epidemiological study or observational epidemiological study. I have already uploaded a video about the classification of epidemiological study, so you can go through that. In that you can find out what are the different types or classification of epidemiological study. Then analytical study goes further than the descriptive study. As you know, I have been already uploaded all those videos regarding descriptive study. Okay, you can go through that to understand better about the descriptive study. So analytical study goes or beyond or after or goes further the descriptive study by analyzing the relationship between the risk factors, that is exposure, and the health problem, that is disease or outcome or health event. Okay, so here we do analyzation. Okay, that is analyzing the what is the relationship of why this disease is caused by this particular factor or exposure, or why this etiology caused this particular disease. That relationship will be find out in analytical study. Thus, it is the second major type of study after the descriptive study. We will find the relationship of the factors with the particular problem in analytical study. So, the important aspects of the analytical study is steps in analytical study. So, we have 11 steps in analytical study. So, when we discussed about the descriptive study, we have 10 steps, almost the same steps only, but in analytical study, we have one more step. Okay, that is regarding the decreasing bias and confounding variables. So, remaining all the steps are same as descriptive study. I have already uploaded a video about the steps in descriptive study. That is an important topic in community health nursing. So you can go through that. After studying in detail about the descriptive study, it will be easy to understand the analytical study. As it is the same steps, there are some differences because we are using the different type of study or design in analytical studies. So the steps of analytical study includes the first one is defining the research problem or question, and even defining the objectives, and here we have a formulation of the hypothesis. Okay, usually we formulate hypothesis if the analytical study is a continuation of the descriptive study. Okay, at the end of the descriptive study we form the hypothesis that will be checked through analytical study or confirmed through analytical study. So the first step is either defining the research problem or question or formulating the hypothesis for the analytical studies. Second is same selecting the study design, various designs. Okay, design selecting. Third one is defining the study population for the study. So usually analytical study is a comparative study. Okay. Then fourth step is defining the study variables. So here also we have independent and dependent variables that said as exposure variable and outcome variable. Then minimizing or decreasing the bias, and that is nothing but error, and the confounding variables that also cause, that also distort our studies or negatively affect the study. Then followed by seventh step is data analysis. Then same thing, interpretation of the result of the study after analysis. Then ninth step is reporting and dissemination of the finding of the study. Then 10th one is recommendations and future studies, and last one is ethical considerations. So these are the important 11 steps in analytical studies. So for easy understanding and better understanding, I have made the same mnemonic like a descriptive study. Instead of 6 Ds, we have 7 Ds because we have 11 steps in analytical studies. Okay, so 7 Ds, 3 Rs, which make easy steps. So this is a mnemonic for you. So first you study well about the steps in descriptive study, then it will be easy how to add one more step, then it become analytical studies. So first D stands for defining the research problem or research question or objectives for the research study or formulation of hypothesis or preparation of hypothesis or defining the hypothesis. Second step is, or second D stands for design selections. So selecting the study design or study type in analytical study. We have a different 3 important types. Then third D stands for defining the population of the study. Based on the design, we have to select the study population or samples. Then defining and measuring the study variables. Okay, independent, dependent variable. Here we call it as a exposure and outcome variable. Then as usual data collections. Thus 5th D stands for data collection and 7th D stands for decreasing the bias, okay, or error occurs in the study, okay, that is selection bias or information bias. So decreasing or minimizing the bias and confounding variables, okay, that also distort, that also negatively affect the studies, which make error in our studies. Thus we have to minimize or decrease the bias and confounding. Then 7th step is, or 7th D stands for data analysis. Then followed by we have 3 R's. First R stands for result interpretation. Then second R stands for reporting and dissemination of the finding or result of the study. Then third R stands for recommendation for future studies or further studies. And last one is 11th step is that is easy steps, that is ethical consideration for the analytical studies. So in this way you can remember better about the 11 steps in analytical studies. So let us explain in detail about the 11 steps of analytical studies. Now the first step is defining the research question, research problem, objectives or formulation, prepare or defining the hypothesis for the study. Okay. So analytical study start by defining or identifying a clear-cut specific hypothesis. Maybe that is already made in the descriptive study. Okay. So defining a clear specific hypothesis regarding the relationship between an exposure, between the cause or between the risk factors or determinants and the outcome of the disease, okay, or the health problems, okay. So define or identifying a clear specific hypothesis regarding the relationship between or association between the exposure and the outcome of the problem. This usually involves determining whether a particular exposure, particular factor, okay, or predisposing factor, okay, for example smoking, increases or decreases the risk for that particular problem or the particular health outcome such as lung cancer. Whether smoking causes lung cancer, the relationship of the smoking and lung cancer. How strong smoking will cause the lung cancer. So defining research question or research problem or formulation of hypothesis usually involves the determining whether a particular exposure increases or decreases the risk for the particular problem. For example, smoking and lung cancer. Then second step is design selection. So select the study design or type of study for the analytical study. So choose the most appropriate, most relevant analytical study design to test the hypothesis which are made in the first step. The common type of analytical studies include cohort study, either prospective study or retrospective study. Prospective study means forward looking study, retrospective study means backward looking studies. Then case control study, cross-sectional study, ecological study and even randomized controlled trial, that is analytical RCT study, okay, and even we have a field trial study, okay, non-randomized analytical study also. All those studies I have explained in detail in my video which I have uploaded as a classification of epidemiological study. You can go through that, okay. Then third step is defining the study population. So finding out the population for the or sample for the particular study. So it may be cohort study, it may be case control study, or it may be cross-sectional study, or it may be RCT, randomized controlled trial. Based on that, we have to select the population. If cohort study means we have to select the population that is exposed to people and unexposed groups for the particular study. Okay. So the smokers with the lung cancer or smokers without lung cancer, like exposed and unexposed groups. Whereas in case control study, we have to select the cases. Cases is nothing but people with a particular problem. For example, smokers with the cancer, okay. Then control is people without problem, okay, smokers without a cancer. That is case control study, okay. Then, whereas in cross-sectional study, we should have a target population for the data collections, okay. In RCT, randomized control trial, we need both study population and control population, experimental population and control population, okay. And moreover, we have to set or make sure the inclusion and exclusion criteria, okay, that should be clear to avoid the selection bias. So the sample has to be selected or study population has to be selected according to the type of the study, according to the design of the study for the analytical epidemiology. Then fourth step is defining and measuring the variables. So the study variable in analytical study includes the same like a independent variable and a dependent variable. Independent variable is called exposure. Okay, so we have to clearly define the factors, okay, under investigation or under study, okay, analytical study, such as smoking, diet, environmental exposures, any particular or specific treatment, etc. all comes under exposure that considered as an independent variable of the study. Then we have to define the dependent variable, that is the outcome of the problem, okay, disease or health outcome. So clearly define the health outcome of interest, such as a specific disease like diabetes, heart diseases, obesity, etc. or health event such as mortality, then hospitalization, okay, admitted patients, etc. This would be the outcome of the dependent variables of the particular study. Okay, then we have to make sure or ensure that both exposure and outcome variables are measurable, accurate and consistent, okay, across the participants. So it has to be measured from the participants, it should be accurate according to the type of the participant, and it should be relevant and consistent. Okay, so that is regarding the defining and measuring the variable, fourth step of analytical study. Now the fifth step is data collection. So based on the study, we have to collect the data from the samples. Okay, so in cohort study, we have to collect the data of exposure details. Okay, that is collect the exposure data at base range and follow up with the participants over time to assess the outcomes. Usually cohort study is the prolonged or longitudinal study. Okay, we have two types of forward looking and backward looking study, but it is a longitudinal study. Okay, so we have to follow up the samples of the study or study population. Then for case control study, we have to collect the retrospective study, okay, data. That means the case is already occurred, okay, already there is a disease. So we have to collect the backward data of the exposure of the case, okay. That has to be collected from both the cases and controls. It is a comparative study, so we have two study group, cases and controls. For cross-sectional study, we collect only once, okay, collect both exposure data and outcome data at a single point in time, okay, from the study population or target population. Then if the study is analytical randomized control trials, so we have to randomly assign the participants in study group and control group, and we have to collect the data from both the study group and control group, and we have to follow them over time to assess the data of the outcome studies. So we have a pre-test data and post-test data from the study group, that is experimental group, and from the control group. Data source or source of the data for analytical study, that is the same like a descriptive study. We can get the data by making interview or assessing through structured questionnaire, medical records of the patients or the cases, laboratory test, laboratory reports and other documents. Okay, so we can collect data from direct and indirect sources. Different sources or method of data collection can be used. Then sixth step is decreasing or minimizing the bias and confounding variables in the study. So for the accuracy of the study, we have to decrease or minimize the bias and confounding variables. What do you mean by bias and confounding factors? So bias can be either selection bias. If you are not selecting the study population in an accurate measure, there will be error in selection. Okay, and data collecting from this selected participants or samples also, if you are not collecting properly, then there would be information bias. Like that, there would be two bias that will affect the study, or that will negatively affect or that make error in the studies. Like that, we have confounding variables. Okay, that means when an outside factor, okay, variable is related to both exposure and outcome, it may influence directly to the study participants, so that may distort the study. Okay, so both bias and confounding factors can distort the study result or findings. So thus it has to be controlled. The measures used are controlling of the confounding variables. So we have different techniques. So use techniques like stratification, matching of the samples. So matching the samples means same specific or similar features of the samples can be collected both in experimental and control group, both in case and control, both in cohort studies. Okay, then we can make a statistical adjustment. By using statistics also we can minimize the bias. Example, multivariate analysis can be applied. Okay, So by doing multivariate analysis, we can reduce we can control the confounding variables and bias. Okay. Then we can also apply the blinding technique. So especially in RCT, randomized controlled trials, we use the blinding, either single blind or blinding or double blinding. Okay. Single blinding, here researcher may not be knowing the samples. And double blinding, both researcher and samples doesn't know or do not know each other's. Okay. Thus, we can prevent the bias in data collection and analysis of the study. Okay. Then 7th step is data analysis. After collecting data, we have to go for the analysis of the data to find out the association. So, data analysis include in analytical study such as measures of association and finding out the statistical significance of the association. First one is measures of associations. So, use of statistical method, biostatistical method to calculate the measures of association between the exposure and the outcome of the particular problem. Okay, between the predisposing factors or the etiological factors or determinants and the outcome or disease. Okay, so using statistical method, we can measure the association. Okay, in analytical study, in cross-sectional study, use the statistical method to find out the prevalence rate. Okay, prevalence is nothing but both old cases and new cases of a particular problem in a community we call prevalence. That rate can be identified through cross-sectional analytical study. Okay, then in case control study, we can find out the exposure rate in case and control and odds ratio. I will explain this in analytical epidemiology video. Then in cohort study, we can find out the incident rate, the new cases rate in the particular area, and we can also estimate the risk among the exposure people. Okay, that includes a relative risk, RR, and attributable risk. Okay, this all I will explain in my next video, that is when I upload about the analytical study video. Then second analysis includes the statistical significance. So test the association using statistical method or biostatistics such as chi-square test, t-test. Okay, that is the inferential statistics. We use the inferential statistics, that is t-test. Okay, then even regression analysis, etc. Okay, and assess the p-value and confidence interval to determine the strength of the association or strength of the evidence between the exposure and the outcomes. Then at the same time, we adjust for the confounding factors in the analysis to ensure the association is not explained by another variable. Association is clearly explained by or clearly it is related to exposure and outcome. Not any confounding factors are influencing or there is no bias. Okay, that is about the statistical significance. Then 8th step is interpretation of the result. After analysis, we'll get the result or finding of the particular study or analytical study. So evaluate the strength, consistency of the association between the exposure and the outcome. Okay, then interpret the result in the context of study designs. So result will be based on the type of the study or design of the study and based on the population or samples of the study, and it also explain any limitation identified during the study by interpreting the result or finding of the particular study. Now the 9th step of analytical study is report and dissemination. Report presentation of the study finding and dissemination or generalization of the result of the study to the public. Okay, so summarize the finding of the analytical study in a report. Okay, research report or publication of the research findings, which include study objectives, hypothesis, methodology, result of the study, discussion and conclusion of the study. Okay, etc. will be included in the summary of the report or research report. Then after making research report, we have to disseminate the finding to the public. Okay, that is for the especially for the health professionals, concerned health authorities, policy makers to make different health policies, and for the specific or scientific community about to application of the evidence-based practice in the different community or different ward or different area. Okay, that is about a report presentation and dissemination. Then 10th step of the analytical study is recommendations and future or further research in the same area. So various recommendations based on the study finding out could be made. Okay, that means based on the study result, make recommendation for public health interventions or preventive services and policy changes. Okay, health policy, new policy. Okay, or renewal of the present policy. So policy changes or further research. Okay, specific research or advanced research. Okay, to confirm and explore the observed relationship or association between the exposure and outcome. Then suggest various analytical studies to further investigate the causality, causes if needed. Okay, sometimes we cannot prove that relationship between the cause and the particular problem. For that we need further research. For that we can have a suggestion for the various analytical studies such as more detailed cohort studies, prolonged cohort studies, or even controlled trials. That is analytical randomized controlled trials. Okay, that is about the recommendations and further research. The last step is the ethical considerations. Ethical consideration is not the last step. We will start from the data collection or sample selection itself. But that is a general concept. That's what we are discussing in the last step. Okay, ethical considerations. So ensure the informed consent or written consent from the participants to participate the studies. Okay, especially for the cohort studies or even randomized control trials. Here we'll make experimental population and a control population. For that we need informed consent from the samples. Okay, as it is an ethical consideration. Then protect the study participants, their confidentiality. Okay, confidentiality of the data, confidentiality of the sensible data. Okay, and address any ethical concerns related to the study designs, especially in randomized controlled trials. Their intervention may have a risk to the participants. This has to be clearly explained to the participants if there is any interventions or manipulation in the study participants. Okay, then all the data collected by the research has to be kept in confidential. That should not be disclosed if it is a sensitive data. Okay, unless it is required for the improvement of the health of the particular sample or the study population. That is all comes under ethical considerations. So far we have discussed in detail about the 11 steps of analytical study in epidemiology. Okay, hope this video really benefits in your studies and exams. If you feel it is really worth and beneficial, please like, share and subscribe my channel. So stay tuned with the Angel Health Academy for the next an important academic video. Most probably that may be the video of analytical study.